Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G and I'm so happy to have you guys back to listen again to this episode. We are going to talk all about hands, and we often forget that our hands are exposed to all elements outside. We have the rain, the wind, the sun, the chemicals in the air, the UV damage, which I said the sun, and free radicals. So we don't typically think to put product on our hands, which that's definitely an option, but we can also rejuvenate our hands gracefully over time. And it's something really beautiful because you can tell someone's age based on their neck, which you should listen to my podcast on my tips and tricks for an amazing neck result, and our hands. And when you compare those things to your face, it really gives those areas of your body to your face. It gives you an idea of your true chronological age. So let's talk a little bit about the anatomy of the hand. I don't think that as aesthetic providers we delve into this so much, so I wanted to give you almost a Cliff Notes version. The hands are very intricate, they're very delicate, and you can rejuvenate both the dorsal aspect of the hand and the dorsal aspect of the fingers. We're going to talk mostly about just that dorsal surface of the hand and not the fingers today. But the skin and the layers are very thin. So you need to be extremely cautious when you are injecting. It's also important to understand that even though you can often visualize the venous system and the venous structures, they're encased with fascia, and I'll go through the layers for you. It is important to understand the vessels, and you can have intravascular injection. It's relatively hard to do if you're staying superficial and using a microcannula, but the major arteries are actually on the volar surface, so on the palmar surface. So let's go into the layers. So we have the skin on the top, and then right below that skin, we have the superficial fascia. And right below the superficial fascia, you have the superficial lamina. So this layer 2, the dorsal superficial lamina, is super important, and it's super thin, and you don't want to pierce this layer because below that is where you have all of your vessels, and I'll get there. Your key area of injection should be between the skin, the space between the skin, and that dorsal superficial fascia. Okay, and a way to remember this, you get laminas and fascias and all of these words that get really confusing. I like to look for associations. So dorsal superficial fascia, filler goes above and in that space between the skin and the dorsal superficial fascia. So I'll say it one more time. The space between the skin and the dorsal superficial fascia. So below the dorsal superficial fascia, you have the dorsal intermediate lamina, and this is where you don't want to inject, you don't want to pierce this lamina. This is where you have your vessels, your arteries, your veins, your sensory nerves, and it's super important that you stay away and superficial to the dorsal intermediate lamina. So next you have the extensor tendons, which are relatively superficial, but they are underneath all of these very thin layers. So you have the dorsal intermediate lamina, and then you have the extensor tendons that are just below that. So underneath the extensor tendons, you then have the dorsal deep fascia. You also have the lumbrical muscles that are surrounding these areas, and those are pretty much the layers you need to know. Again, the most important and distinct space you need to be aware of is the space between the skin and the dorsal superficial fascia, the DSF. Okay, so I hope that makes sense for you guys. Now let's get into product, and what do I typically use? Well, it does depend on the age of the patient and the thinness or thickness of that hand skin. And if it's somebody that's a little bit more mature, you want to use a product that's not going to be too clumpy, lumpy, and visible. Hands do tend to swell a bit, and I'll give you a couple tricks for that. But I like to use either hyaluronic acid that's essentially a little bit blended with a little bit of extra lidocaine, both for the comfort of the treatment and for the result. So I'll like to use Restylane Lift or Restiel if you want a little bit more hydration. It really varies if you want something that's softer and more hydrating, or if it's something that has a little bit more structure like Lift. Lift is my go-to, but again, Restylane Refine, Define, they would all be really beautiful, to be honest. The other option would be to blend a hyaluronic acid filler with something like PRF. And so if that patient wants to use their own body to help rejuvenate that skin and the tissues, you can do that. You can also do PRF alone. I don't think the result is as obvious in hands, but again, it depends on the patient. My go-to is really hyperdilute Radiesse, and it is beautiful. You can use anything from an 8-to-1 reconstitution. You can go up to 10 or 11-to-1. You just get more volume there. And because the hands are a really small, compact space, you want to be aware of the amount of volume that you're putting in the hands. They do tend to swell. So after I'll inject one hand, I'll have the patient sit on that hand so that you can minimize any swelling. But I don't think I would do more than a 10-to-1 dilution for Radiesse just because of the amount of volume that you're getting there. The other thing you can do is you can blend in a little bit of HA to your Radiesse. So let's say we're using 8-to-1 for Radiesse, and then blending in a little bit of Restylane Lift or Restylane Silk for some added hydration. So in general, I think these treatments are amazing. Patients will typically do them once or twice a year. I think it's better to start earlier because it really, not only is it protective and hydrating for your hands, but it's beautiful. We use our hands all the time, and it helps to maintain that beauty and youth and association connection with the facial anatomy and facial aesthetics in your hands, if that makes sense. So let's keep it all harmonious. I hope that you guys learned a little bit there with anatomy and my tips and tricks for hands. Let me know what you think. Questions, comments below. I'll see you at the next one.